Alrighty, hello and welcome back to our next lecture. This one is on infection prevention and control. Another big part of what's important in nursing is trying to help our patients stay safe and also watching out for infection and how to prevent it and how to control it when it happens. So the incidence of patients developing infection as the direct result of contact during healthcare is increasing. So current trends, public awareness, and the rising costs of healthcare have increased the importance of infection prevention and control. So nurses, of course, are essential in infection prevention and control, and patients in all healthcare settings are at risk for acquiring infections because of their lower resistance to pathogens, their increased exposure to pathogens, and some of which of those may be resistant to most antibiotics. And of course, invasive procedures that we're going to be doing with them. In all healthcare settings, healthcare providers, as well as patients and their families, need to recognize sources of infection and be able to apply protective measures. So, patient teaching must include basic information about infection and various modes of transmission and appropriate methods of prevention like hand hygiene and covering their cough. Increases in multi-drug resistant organisms known as the MDROSs are healthcare acquired infections, and concern about diseases such as hepatitis B and hepatitis C, HIV, and TB do require greater emphasis on infection prevention and control techniques. Okay, so with that being said, we will talk about our objectives here. So your objectives are going to be discuss caring in nursing practice for individuals and families, defining disease, differentiating between acute and chronic diseases, and review the body's response to disease, stress, and inflammatory processes. So we need to examine the concept of situational awareness in ensuring a safe safe client environment. All right. So on to the next slide are some more objectives for us to focus on. So we're going to describe the importance of quality and safety in patient care, which we did with our last lecture as well. We're also going to identify sources of infection and standard precautions for infection control when providing client care. And we're going to examine some methods for providing basic care and comfort to our clients. We also need to be able to recognize the modes of transmission for common communicable diseases. And of course, assessment is always important for the nurse. So we're going to assess appropriate techniques and regulatory requirements for safe client handling. Again, here's our scientific knowledge base. So disease or infection results only if the pathogens multiply and alter normal tissue function. So some infectious diseases such as viral and meningitis and pneumonia have a low or no risk for transmission. Although these illnesses can be serious for patients, they don't usually pose a risk to others, including their caregivers. Hepatitis C is an example of a communicable disease that can be asymptomatic. It is most effectively transmitted through the direct passage of blood into the skin from a percutaneous exposure, even if the source patient is asymptomatic. Okay, so this is the chain of infection. You probably have seen this before. I'm sure most people have seen this before. It is in your book. This is chapter 28. So figure 28.1 is illustrated here. So the chain of infection. So just remember that the presence of a pathogen does not mean that infection will occur. Infection develops if the chain stays intact. Preventing infections involves breaking the chain of infection. Microorganisms include bacteria, viruses, fungi, and protozoa. So transient microorganisms attach to the skin when a person has contact with another person or object during normal activities. These organisms may be readily transmitted unless removed using hand hygiene. Hand hygiene is the most effective way to break the chain of infection. And we certainly have heard that everywhere lately. And it's a very good lesson for people to think about and to learn from. A reservoir is a place where the microorganisms survive, multiply, and await transfer to a susceptible host. So that is important. Frequent reservoirs for healthcare-associated infections, also referred to as HAISs, include healthcare workers, especially their hands. Patients, equipment, and the environment are also things that we look at. Human reservoirs are divided into two types, those with acute or symptomatic diseases and those who show no signs of disease but are carriers of it. We've also talked about that lately in the world. To thrive, organisms require a proper environment, including appropriate food, oxygen, water, temperature, pH, and light. Aerobic bacteria requires oxygen for multiplication sufficient to cause disease. Anaerobic bacteria thrive where little or no free oxygen is available. So most organisms require water or moisture for survival. Some bacteria, though, assume a form called a spore, which is resistant to drying and can live on inanimate surfaces for long periods of time. The ideal temperature for most human pathogens is 20 degrees to 43 degrees Celsius or 68 degrees to 109 Fahrenheit. Most microorganisms prefer an environment within a pH range of 5.0 to 7.0. Microorganisms thrive in dark environments such as those under dressings and also within body cavities. After microorganisms find a site to grow and multiply, they must find a port of exit if they are to enter another host and cause disease. Portals of exit include sites such as blood, skin, and mucus membranes. Respiratory tract, the GI tract, the gastrointestinal tract, and transplacental from mother to fetus. The major route of transmission for pathogens identified in the healthcare setting is the unwashed hands of healthcare workers. Very important. Equipment used within the environment often become a source of the transmission for the pathogens. Organisms enter the body through the same routes as they use to exit. Susceptibility to an infectious agent depends on the individual's degree of resistance to the pathogens. Very important things for you to know. Okay, so here is our first quick quiz. And again, we're going to talk about these in class. So we want you to be looking at them and see if you can pick out which one is the correct answer. And in class, we'll talk about why this is the right answer. Okay, when the patient acquires an infection, we usually observe for signs and symptoms of infection and take appropriate actions to prevent its spread. Infections follow a progressive course. The incubation period is the time between entrance of the pathogen and the appearance of the first symptoms. Prodromal stage is the interval, from onset of non-specific signs and symptoms to more specific symptoms. And illness stage is the interval when the patient manifests signs and symptoms specific to that type of infection. Convalescence is the interval when acute symptoms of infection disappear. If an infection becomes localized, as in a wound infection, we use standard precautions, appropriate personal protective equipment, PPE, and hand hygiene to block the spread of the infection to other parts of the body or other patients. Supportive therapy does include providing adequate nutrition, rest to bolster the body's defense against the infectious process, and the course of care for the patient often has additional effects on the body systems affected by the infection. This probably isn't anything new to you guys. I'm sure you've read about this in your prerequisites when you were coming into the nursing program. So, any of these body defenses fail, an infection usually occurs and leads to a serious health problem. Normal flora or microorganisms that reside in the body, they do not usually cause disease when residing in their usual area of the body, but instead participate in maintaining the health. The use of broad-spectrum antibiotics for the treatment of infection may eliminate or change that normal flora, leading to a superinfection. A superinfection develops when broad-spectrum antibiotics eliminate a wide range of normal flora organisms, not just those causing the infection. When normal bacterial floras are eliminated, body defenses are reduced, which allows for disease-producing microorganisms to multiply, causing illness. A number of body organ systems have unique defenses against infection. Each organ system has defense mechanisms that are physiologically suited to its specific structure and function. Inflammation, then, is a protective vascular reaction that delivers fluid, blood products, and nutrients to the area of the injury. The process neutralizes and eliminates pathogens or dead necrotic tissues and establishes a means of repairing body cells and tissues. Signs of localized inflammation include swelling, redness, heat, pain, or tenderness, and the loss of function in the affected body part. When inflammation becomes systematic, other signs and symptoms develop, including fever, increased WBCs, white blood cells, malaise, anorexia, nausea, vomiting, lymph node enlargement, or organ failure. After tissues are injured, a series of well-coordinated events occur. The inflammatory response includes vascular and cellular responses, formation of inflammatory exudates, fluid in cells that are discharged from cells or blood vessels. This could be pus or serum, and tissue repair. Injury causes tissue damage and possibly necrosis. As a result, the body releases chemical mediators that increase the permeability of the small blood vessels, and fluid, protein, and cells enter the interstitial spaces. Due to some physiological inflammatory response, the involved body part may have a temporary loss of function. The cellular response of inflammation involves white blood cells arriving at the site. The WBCs pass through the blood vessels and into the tissue. Through the process of phagocytosis, specialized WBCs called neutrophils and monocytes ingest and destroy microorganisms or other small particles. Leukocytosis, or an increase in the number of circulating WBCs, is a response of the body to the WBCs leaving blood vessels. Exudate may be cirrhosis, which is clear like plasma, sanguinous, hard to say those words, containing red blood cells, or purulent, which contains white blood cells and bacteria. Usually the exudate is cleared away through the lymphatic drainage. Platelets and plasma proteins such as fibrogen form a mesh-like matrix at the site of the inflammation to prevent its spread. When there is injury to tissue cells, healing involves the defense, reconstructive, and maturative stages. So damaged cells are eventually replaced with healthy new cells. I know you know all that stuff. Okay, and here is a review box 28.2 in your book and 28.3 and 28.4 in your textbook. So review that table 28.2 in the textbook because it has some good information in it. So the healthcare associated infection, the HAI, we talked about a little while ago, can occur as a result of invasive procedures, antibiotic administration, and the presence of multi-drug resistant organisms, and breaks in infection prevention and controls activities. Invasive procedures, medical therapies, long hospitalizations, and contact with healthcare professional increase a hospitalized patient's risk for acquiring the HAIs. Meticulous hand hygiene practices need to be done so that we can take care of our patients. Chlorhexidine washes and other advances in intensive care unit infection prevention help to prevent some of those bad infections. Okie doke. So here we go. We'll talk about infection is a type of the HI that results from a diagnostic or therapeutic procedure. For example, procedures such as bronchoscopy and treatment with broad-spectrum antibiotics have been shown to increase the risk for certain infections. Healthcare-associated infections may be exogenous or endogenous. So an exogenous infection comes from the microorganisms found outside the individual, such as Salmonella. They do not exist as normal flora. And then endogenous infection occurs when the part of the body's flora becomes altered and an overgrowth results, as with a staphylococci. This often happens when a patient receives broad-spectrum antibiotics and alters the normal flora. When sufficient numbers of microorganisms normally found in one's body site move to another site, an endogenous infection can develop. Major sites for HAIs include surgical or traumatic wounds, urinary, respiratory tracts, and the bloodstream. HAIs significantly increase the cost of health care. Older adults have increased susceptibility to these infections because of their affinity to chronic disease and the aging process itself. Extended stays in healthcare institutions, increased disability, and increased costs of antibiotics and prolonged recovery times add to the expenses both for the patient and for the healthcare institution and the funding bodies. All right, here's our case study number 1 of 3, and this is about Mrs. Eldridge. She's 63 years old and underwent total hip replacement. So look that over, and we will talk about that in class too. So what do the fever and the warm, swollen incision likely indicate? And is an infection at the wound site likely to be systematic or localized? And like I said, we will talk about this in class, but I want you to try to answer those questions so that when we go over them, we can get through it. Okay, so on our next slide, we're going to talk about healthcare workers are at risk for exposure to microorganisms in the hospital and or the home setting. Again, this has been on the news and we've heard a lot about it as some of our nurses and our physicians who've been treating the epidemic have passed away from those problems. So when a patient requires isolation measures, we help patients and families reduce some of these feelings by discussing the disease process, explaining isolation procedures, and maintaining a friendly and understanding manner. Multiple factors influence a patient's susceptibility to infection. It's important to understand how each of these factors, alone or in combination, increase this risk. Throughout life, susceptibility to infection changes. An infant has an immature defense against infection. The young and middle-aged adults have refined defenses against infection, and older adults, immune response decline. So particularly their cell-mediated immunity. So a patient's nutritional health directly influences the susceptibility of infection as well. So reduction in the intake of protein and other nutrients such as carbohydrates and fat reduces the body's defenses against infection and impairs wound healing. So the body responds to emotional or physical stress by the general adaptation. If stress continues or becomes intense, elevated cortisone levels result in decreased resistance to infection. Continued stress leads to exhaustion, which causes depletion of the energy stores, and the body has no resistance to invading organisms. Patients with diseases of the immune system are at particular risk for infection. Leukemia, acquired immunodeficiency syndrome or AIDS, lymphoma, and aplastic anemias are conditions that compromise a host by weakening the defenses against the infectious organism. Patients with chronic diseases such as diabetes and multiple sclerosis are also more susceptible to infections because of the general debilitation and nutritional impairments that are there. Diseases that impair body system defenses increase susceptibility to infection, and patients with burns have a high susceptibility to infection because your skin is a very protective organ of our body. And here we have another case study that we'll talk about in class. So what is the granulation tissue all about? We will talk about that in class. Okay, now we've talked about the nursing process before, and we're going to talk about it a little bit here. As you recall, assessment is the first step of the nursing process. Medication history is going to be necessary to identify medications that increase a patient's susceptibility to infection, like we just talked about those a couple of slides ago. An analysis of laboratory findings provides information about a patient's defense against the infection, and the early recognition of the infection or risk factors helps us to make the correct nursing diagnosis and establish a plan of treatment for our patient. Okay, so on table 28.3 and 28.4 and 28.5 in your textbook, it talks a little bit more about the nursing process. So some patients with infections have a variety of problems. It is important to ask specific questions to determine if the patient and family's needs are related to the risk for the infection or disease status. So we ask the patient how the infection affects the ability to maintain relationships and perform activities of daily living. Determine whether chronic infection has drained the patient's financial resources. And we also need to encourage the patients to verbalize their expectations so that you are able to establish interventions to meet the patient's priorities. We review physical assessment findings and the patient's medical condition to determine the status of normal defense mechanisms against the infection. We assess your patient's medication history to determine whether he or she takes any medications that would increase infection susceptibility. We also look for signs and symptoms of infection that may be local or systematic. Localized infections are most common in areas of the skin or mucous membranes. It breaks down such as surgical and traumatic wounds, pressure ulcers, oral lesions, or abscesses. Systemic infections can develop after treatment for localized infection has failed. Be alert for changes in the patient's level of activity and responsiveness. An infection does not always present with typical signs and symptoms in all patients. Atypical symptoms such as confusion, incontinence, or agitation may be the only symptom of an infectious illness. And older folks are very susceptible to getting a UTI. And one of the first things that we notice is that our patient becomes confused and doesn't know what's going on, and sometimes can't even remember their name. And so we think that they're having a stroke or something when actually they just have a UTI. So that is a very important part, is to look into all those other things that could be going on with your patient. Laboratory values such as increased WBCs or a positive blood culture often indicate infection. Laboratory values are not enough to detect infection. You need to assess other clinical signs as well. Here's a quick quiz, and I know that the answer is there, but try to answer it without looking at the answer. You're caring for a patient who underwent surgery, and the physical assessment, you notice that the wound looks red and swollen, and the patient's WBCs are elevated. What should you do for this patient? Alrighty, so we'll talk about that in class, all the things that we will do. Okay, so when we're looking at our nursing diagnosis, we've gathered all of our information. We used our critical thinking. We've looked at all different areas here. So now we're going to try to figure out what is our problem. We know that we have a risk for infection. Everybody that's in the hospital, everybody, including the nurses, the visitors, everybody is at risk for infection because they're in a hospital and there's a lot of things that are going on around there. So we need to, when we're looking at our patient, we know that everybody's at risk for infection, but for this, if they actually had an infection, it would not be a risk for, it would be an actual problem. So make sure that you watch how you state things. So anyway, this is in box 28.6 in your book. So after gathering that objective and subjective, objective is what we see, subjective is what our patient tells us or reports to us. We review that data carefully, looking for clusters of defining characteristics or risk factors that create a pattern. So this pattern suggests a specific nursing diagnosis. So success in planning appropriate nursing intervention depends on the accuracy of this diagnosis and the ability to meet the patient's needs. So this requires an accurate related to factor in the diagnostic statement. So here in our slide, it's showing us imbalanced nutrition, less than body requirements, impaired oral mucosis, and there will be many things. So you can look in your care plan book that will give you some ideas about that as well. Okay, so now we have our diagnosis and we're ready to work on the planning section. Do you remember the planning part that we talked about last time too? Again, there's you can review box 28.7 and 28.2 in your textbook. So we develop a care plan that sets realistic outcomes so interventions are purposeful, direct, and measurable. Patients often have multiple nursing diagnoses that are interrelated, and one diagnosis impacts on the other diagnosis. We talked about that before as well too. Okay, so for here, we're going to the priority of administering therapies to promote wound healing, such as improved nutritional intake, overrides the goal of educating the patient to assume self-care therapies at home. When the patient condition improves, the priorities are going to change, and the patient education then becomes an essential intervention. The development of a care plan includes prevention and infection control practices from multiple disciplines. So select interventions in collaboration with the patient, the family, and the healthcare provider, such as the dietitian or the respiratory therapist. Know the patient's sociocultural preferences to help you to identify the most appropriate types of interventions. Consult with an expert in infection control in planning the patient's care. And also, before discharge, consult with case management to complete a home assessment and identify home health needs for our patient. Our next case study and the last one for this lecture is about Mrs. Eldridge, and she continues recovering at home. So think about what outcomes would you set for this activity, and also think about instructing patient about proper hand hygiene and other things that she can do to make sure that she's taking care of her infection, and then have her demonstrate things so that you know that she is ready to go home and that she knows what to do. We're also going to instruct her about signs and symptoms of wound infection and when to notify her doctor. We're also going to instruct her to place contaminated dressings and other disposable items containing infectious body fluids in an impervious plastic or brown paper bag. Of course, needles that she might use need to be in metal containers so that they can't get into the trash and stick somebody that way. That would not be a very good thing. And some states have specific requirements for sharps disposals, so you as a nurse should be checking with the local regulations just to make sure that you're teaching correctly. So we're going to instruct the patient to clean noticeably soiled linen, separate that from the laundry, wash in warm water and detergent. No special recommendations for setting, drier temperatures or anything like that. Okay, so use your critical thinking skills to prevent an infection from developing or spreading, nutrition support, rest, maintenance of physiological protective mechanisms, and recommended immunizations to protect our patients. In healthcare settings, implement procedures to minimize the number and kinds of organisms that could be transmitted. Be aware that various cultural and religious beliefs or practices influence patients and decisions to seek treatment for an infection or to use methods to prevent infection, including eliminating reservoirs of infection and controlling ports of exit and entry, and avoiding actions that transmit microorganisms. Having an infection prevention and control also will help you to apply those principles of medical and surgical asepsis. To identify the causative organism, the nurse collects specimens of body fluids such as sputum and drainage from infected body sites for cultures. Systemic infections require measures to prevent complications or fever, and localized infections often require measures to assist removal of debris, to promote healing, and use medical and surgical asepsis techniques to manage wounds and ensure body handling of all drainage of body fluids. During the course of the infection, we need to support the patient's body defenses mechanisms. In your book, you can look at boxes 28.8, 28.9, and 28.10, and there's also tables 28.5 and 28.6 in the textbook. So in the nursing skills laboratory, you will practice hand hygiene, how to prepare a sterile field, surgical hand asepsis, how to apply a sterile gown, and how to perform closed and open gloving. These two types of aseptic technique are medical and surgical asepsis. Medical asepsis or clean technique includes procedures for reducing the number of organisms present and preventing the transfer of organisms. After an object becomes unsterile or unclean, it is considered contaminated. In medical asepsis, an area or object is considered contaminated if it contains or is suspected of containing pathogens. Standard precautions apply to contact with blood fluid, non-intact skin, and mucous membranes for all patients. We use standard precautions on every patient because we don't know what we don't know. And if we don't know that a patient has a certain infection, then we could be affected by that without even knowing. So we always use standard precautions on everybody. A major component of patient and worker protection is hand hygiene. The purpose of hand hygiene is to remove microorganisms mechanically from the hands and rinsing with water. Hand washing does not kill the microorganisms, it just washes them off your hands. Healthcare workers have well manicured nails and refrain from wearing artificial nails to reduce microorganism transmission. It was probably about 20 years ago where a nurse with artificial nails was carrying a bacteria under her nails, and she worked in a NICU, and there were 20 babies in the NICU that died from the bacterial infection that she had with her nails. We all girls love to have beautiful nails, but when you're a nurse, that comes second. So you never wear artificial nails, and many places want your nails to be cut very short, and they don't want you to wear any kind of nail polish at all, not even clear polish, because it can harbor infection, it can harbor microorganisms. So just remember that as a nurse, you have to kind of give up your nice manicure, but you can still do pedicures. The manicures have to kind of go. So if hands are not visibly soiled, and we can use the alcohol-based hand rub to decontaminate the hands in the following situations. So before and after, between direct patient contact, taking a pulse, lifting a patient. Before putting on sterile gloves and before inserting invasive devices such as a peripheral vascular catheter, we need to wash our hands very well before we put our gloves on. So after contact with the body fluids or secretions, we need to wash our hands. When moving from a contaminated to a clean body site, we need to wash our hands. After contact with surfaces or objects in the patient's room, we need to wash our hands. After removing our gloves, we definitely need to wash our hands. Some people think that if they have gloves on, that their hands are clean. But the gloves are porous. Things can go through the gloves to your skin. So it's very important that once you remove your gloves, that you do good hand hygiene as well. Just when in doubt, wash your hands. Wash your hands. It's just the way it has to be now. Okay, so it talks about in your book, in chapter 29, box 29.8, it talks about evidence-based practice about the benefits of chlorhexidine bathing. And so we do see quite a bit of that now in the hospitals because of all the pathogens that we have. So the Joint Commission, the TGC, and the Centers of Disease Control and Prevention do the Speak Up campaign, encourage patients to take a role in preventing their healthcare errors, and we talked about that in the other lecture as well. It's the same thing, but it's not unusual now for patients to say, or their family, hey, you didn't wash your hands, or you didn't wash your hands. Doctors sometimes are really bad about coming in and just wanting to talk and not touch their patient, but they should wash their hands when they come in the room. And I've seen families call them out too, which is always kind of fun. All right, the effectiveness of infection. The prevention practices depends on the conscientiousness and consistency of using effective aseptic techniques by all healthcare providers. Okay, so general cleaning involves use of water and mechanical action with detergents or, some kind of product. When an object comes in contact with an infectious or potentially infectious material, it is contaminated. If the object is disposable, it is discarded. Reusable objects need to be cleaned thoroughly before reuse and then either disinfected by sterilized according to the manufacturer recommendations. And that's what we see a lot. We send them to the lab to be sterilized. You can accomplish disinfection using a chemical disinfectant or wet pasteurization used for respiratory therapy equipment. Steam under pressure is another thing that sometimes we don't do and see that they do in the lab. The decision to clean and disinfect or sterilize depends on the intended use of that item. The following factors influence the efficacy of the disinfecting or sterilizing method. Concentration of the solution, the type and number of the pathogens, the surface areas to treat, and the temperature or the environment. The presence of soap is another thing that is something that we consider, and then the presence of organic materials also. All right, then the effective prevention and control of infection requires you to remain aware of the modes of transmission and the ways to control them. In the hospital, home, or extended care facility, a patient needs a personal set of care items that are not shared with anybody else. Handling exudate, we need to empty urinals, bedpans at water level. We don't want to splash that, obviously. We need to dispose of disposable soiled items in trash bags, dispose of items with large amount of blood in the biohazard bag, which is the red bag, and handle laboratory specimens as if they were infectious. We don't know if they are or not, so we're going to just treat it like it is. That way we don't have to worry. To control organisms existing via the respiratory tract, try to cover your mouth or nose when coughing or sneezing. Oh, goodness, so popular today. Teach the patients, healthcare staff, and patients, families, and visitors about respiratory hygiene or cough etiquette. We need to cover our nose and our mouth with a tissue when when we're going to cough, or promptly dispose of that contaminated tissue. Place a surgical mask on a patient who does not, if it does not compromise their respiratory function or is applicable, which may be feasible in pediatric populations. Hand hygiene after contact with contaminated respiratory secretions, spatial separation greater than 3 feet from persons with respiratory infections. And this is from your book, and I think now it's 6 feet. We're trying to get everybody at least 6 feet away from respiratory kind of issues. To prevent transmission of microorganisms through indirect contact, you need to keep soiled items and equipment from touching your clothing. So you got to hold them out in front of you and not touch your clothing. Use fluid-resistant linen bags, or carry soiled linen with hands held out away from your body. Maintaining the integrity of skin and mucous membranes does reduce the chances of microorganisms reaching a host. So keep the patient's skin well lubricated, or using lotion as appropriate. After elimination, instruct women to clean from the rectum and the perineum by wiping from the urinary meatus toward the rectum. Keep the point of connection between a catheter and a drainage tube closed and intact as long as such systems are closed. Their contents are considered sterile. Perform hand hygiene and wear gloves. To prevent entry of microorganisms into the wound, always clean outward from the wound site. When applying an aseptic or cleaning with soap and water, you need to wipe around the wound edge first and the wound outward away from the wound. And you'll learn about that when you're in Skills Lab as well. You'll be doing that. So healthcare facilities are required to have the capability of isolating patients. Isolation practice may prevent personal and patients from acquiring infections from the transmission of the microorganisms, to other persons. Barrier precautions include the appropriate use of PPE, such as gloves, gowns, masks, eyewear, and other protective devices or clothing, which we are becoming very aware of it in this atmosphere. Contact precautions require gown and gloves. Droplet requires the wearing of a surgical mask when within 3 feet, and I'm sure that's going to be 6 feet now of the patient. However, yes, I'll just say that. Okay, of the patient, proper hand hygiene and some dedicated care equipment. Airborne precaution requires a specially equipped room with a negative airflow, referred to as an airborne infection isolation room. It's not a common room. It's a different room that we use for that. So it is a negative airflow room. So not all hospital rooms are like that. So all healthcare personnel are wearing the N95 respirator every time they enter the room. And that's very important. Not just a regular mask, but the N95 has to be used for those rooms. Protective environment requires a specialized room with positive airflow. A patient in isolation is subject to sensory deprivation because of that restricted environment. Regardless of the type of isolation system, we need to follow these basic principles. Use thorough hygiene before entering and leaving the room of a patient in isolation. Dispose of contaminated supplies and equipment in a manner that prevents spread of those microorganisms to other persons or indicated by the mode of transmission of those organisms. Apply knowledge of a disease process and the mode of infection transmission when using protective barriers. Protect all persons who might be exposed during your transport of a patient outside of an isolation room. An infection prevention and control professional, a valuable resource for assisting nurses in controlling HAIs, monitors the incidence of infection within an institution and provides educational and consulting services. Again, review the tables 28.6 in your textbook and 28.13. I know it's a lot. 28.3 from the textbook is the N95 respirator mask, so you can see what that looks like. And when a patient requires isolation in a private room, a sense of loneliness may develop because of that normal social relationships become disrupted, like our people now that are in the hospital and aren't able to have any friends to come see them, and they're very sick, and it's just heartbreaking how horrible it is. We know it can be psychologically harmful, especially for children. We take the opportunity to listen to the patient's concerns or interests. If you rush care or show a lack of interest in the patient's needs, he or she feels rejected and even more isolated. So before you institute isolation measures, the patient and family need to understand the nature of the disease or the condition and the purpose of the isolation and the steps for the following precautions. So take measures to improve the patient's sensory stimulations during isolation, explain to the family, and then private rooms used for isolation sometimes provide that negative pressure airflow to prevent the infectious particles from flowing out into the room or into other rooms that are close. Remain aware of infection prevention and control techniques while working with any patient in a protected environment. PPE should be readily available, and we know we've had problems with that here too. So we'll talk more about the PPEs in your lab. So obtain all culture specimens using clean gloves and sterile equipment, and the use of a single intact standard size linen bag that is not overfilled and tied securely is adequate to prevent infection transmission. So check the color code of the bag and your facility uses for bagging these items. Before transferring patients to wheelchairs or stretchers, give them clean gowns to serve as robes. When a patient has an airborne infection, he or she must wear a mask when leaving the room. Notify personnel in diagnostic or procedural areas of the operating room of the type of isolation precautions the patient requires. Be sure to clean the equipment and an approved germicide after the patient use and before other patient uses that equipment. So an infection control professional's responsibilities often include providing staff and patient education on infection prevention and control, developing and reviewing infection prevention and control policies and procedures, recommending appropriate isolation procedures, screening patients' records for community-acquired infections that are reportable to the public health department, consulting with employees' health departments concerning recommendations to prevent and control the spread of infection among personnel, such as TB or like TB testing. All right, gathering statistics regarding the epidemiology, cause, and effect of healthcare-associated infections, and notifying the public health department of incidents of communicable diseases within the facility. Consulting with all hospital departments to investigate unusual events or clusters of infection. Monitoring antibiotic-resistant organisms in the institution. Healthcare workers are continuously at risk for exposure to infectious microorganisms. OSHA and the CDC publish rules, regulations, and guidelines to help protect employees from bloodborne pathogens in the workplace. So OSHA regulations and CDC guidelines are incorporated into the policies and procedures of the healthcare institutions and are part of regularly scheduled staff educations. So often patients need to learn to use infection prevention and control practices at home. Often you help a patient adapt according to the resources available to maintain a lot of education before they go home. Okay, so now let's talk about surgical asepsis. Surgical asepsis includes procedures used to eliminate all the microorganisms, including pathogens and spores, from an object or area. In surgical asepsis, an area or object is considered contaminated if touched by any object that is not sterile. It depends on the highest level of aseptic technique and requires that all areas be kept free of infectious microorganisms. Use surgical asepsis in the following situations. During procedures that require intentional perforation of the patient's skin, such as an insertion of an IV, catheters, or central lines. when the integrity of the skin is broken as a result of the trauma, surgical incision, or burns. During procedures that involve invasive procedures such as insertion of urinary catheters or surgical instruments into sterile body cavities such as insertion of a wound drain. Although surgical asepsis is common in the operating room, labor and delivery areas, and major diagnostic areas, you also use surgical aseptic techniques at the bedside when inserting IVs, intravenous IVs or urinary catheters, suctioning the tracheobronchial airway, and sterile dressing changes. So in your book, figure 28.5 is where you can find this information. Performing sterile aseptic procedures requires a work area in which objects can be handled with minimal risk of contamination. A sterile field provides a sterile surface for placement of sterile equipment. It is an area considered free of microorganisms and may consist of a sterile kit or tray, a work surface draped with a sterile towel, or wrapped, or a table covered with a large sterile drape. Nurses never turn their back on a sterile field. Once you start opening it, you cannot walk away. You have to stay there and make sure that it stays sterile and that nothing touches it on a sterile tray or leaves it if unattended. So contamination can occur accidentally by a dangling piece of clothing or an unknown patient touching a sterile object. Very important. When beginning surgically aseptic procedure, nurses follow certain principles to ensure maintenance of that asepsis. Failure to follow these principles places patients at risk for infection. Do not talk, laugh, sneeze, or cough over a sterile field or when gathering or using sterile equipment. A sterile object becomes contaminated if gravity causes a contaminated liquid to flow over the surface of the object. So to avoid contamination during surgical hand scrubs, hold your hands above your elbows. The edges of the sterile containers become exposed to air after they are open and thus are contaminated. So these are the edges around that are considered contaminated, so we don't want to touch those. After you remove a sterile needle from its protective cap, or after you remove forceps from a container, the objects must not touch the edge of the container. And you'll get to practice this in Skills Lab, and you can see here how they're touching, this patient or this nurse is touching just the edges of those. So read about that in 28.6 is where this figure comes from. Nurse opens sterile package on work area above the waist level too. It's very important that those things are followed perfectly because it can be a problem if we don't do that. So have the patient's expectations been met? Measure the success of infection prevention and control techniques by determining whether you achieve the goals for reducing or preventing infection. Document the patient's response to the therapies for infection prevention and control. Provide the patient and our family members the opportunities to discuss the infection prevention control measures or to demonstrate procedures such as hand hygiene, reveals their ability to comply with the therapy that we're doing. Patients and healthcare personnel, including housekeepers and maintenance personnel, are at risk for acquiring infections from accidental needle sticks. After administering an injection or inserting an IV catheter, place the used needle in the safety box, which is a puncture resistant box that we use for that. And it's red, so it's easy to see. So all sharps must now be either needle safe or needleless. So report any contaminated needle stick immediately. Additional criteria for exposure reporting include blood or other potentially infectious materials too. So indirect contact with an open area of the skin, blood, or if it's splashed into the healthcare worker's eyes or mouth or up their nose or cuts a sharp object. All of those things we need to follow up on and immediately after they happen. So follow up for risk of acquiring infection begins with a source the patient is begins with the source patient testing. So exposures also occur involving non-blood-borne pathogens, airborne and droplet diseases also pose a risk for the non-immune nurse. Nurses should receive immunizations as recommended by the CDC. Patient outcomes measure the success of the infection. Control techniques compare the patient's actual response with expected outcomes. If goals are not achieved, determine what steps that you need to take next for that. Okay, and here are just some safety guidelines for your nursing skills. And like I said, you're going to be doing a lot of things in labs. So the things that we've just talked about, you're going to get to actually have hands-on with that. So these are some very important safety guidelines for nursing skills. So make sure that you read these and that you know these because they will expect you to know these when you come into the lab. All right, well, that is the end of my slide, and I appreciate your listening to what I have to say.